We're facing a drug epidemic, and law enforcement has dedicated more and more resources to fighting this, and they're fighting it at both the state and federal level. At the state level, they're going out and they're arresting low-level sellers, and they're also arresting people that are buying. And sometimes the two go hand in hand, because if someone's got a drug problem, chances are that they're supporting that drug habit by selling. And so whether you're a cocaine or a pill guy, or even marijuana, which has been decriminalized, but it's still a crime, if you're using drugs, chances are you're probably selling, because that's the profit that you're making to support your habit. And so a guy that's dealing the stuff, and you're making a deal with him where he gives you a certain amount to sell, and then you keep something for yourself. Now, the crimes of selling drugs are a lot more serious than it is to using the drugs. And this is why a lot of times people who are drug addicts end up getting arrested for selling drugs, because that's how they support their habit. And as a result, they end up facing much more serious charges than the mere possession of drugs. If you sell a small quantity of cocaine, you're going to be charged with criminal sale of a controlled substance in the 3rd degree. That's a Class B felony. The maximum penalty for that is 8 1/3 years to 25 years. That is a very long time. On the flip side, if you have a small quantity of cocaine on your possession, that's an A misdemeanor. It's a misdemeanor offense, not a felony offense. And as an A misdemeanor, the most time that you'd be facing is 1 year in jail. So there's a big disparity between selling and possessing. But unfortunately, a lot of times, the people who are using are also selling. And that's where the law can be very unfair. So one of the things you need to do when you're involved representing someone who gets arrested for either selling and or possessing drugs is you need to try to establish, well, am I dealing with someone that has a drug problem who's selling to support his habit? Or am I dealing with someone who is in the business of selling drugs to make money? All right, you need to distinguish between the two. And a lot of cases that I see now, and it's just rampant across Long Island and in the city, is young people that are getting involved with pills and Quaaludes, and it starts out where you have some pain, you had surgery, and the doctor prescribes these painkillers, and the next thing you know, you're on it for months and months, and then when you have to go off it, you don't want to go off it because it feels good not to be in pain, and the next thing you know, you're addicted to it. And then the doctor, he stops writing prescriptions for you because they're monitoring how many prescriptions the doctors are writing, and they get in trouble and they can get arrested if they're writing prescriptions to someone that's not really in need of the prescription. So there's a whole lot more attention in this area now. And so you got to go out and find a substitute because you can't get it from the doctor anymore. So now you're out on the street and you're looking to substitute a drug. And you're finding a drug of choice, whether it's a Roxy or one of these other drugs that are out there now, and all of a sudden you're involved in this. And you become addicted to it. Very easy to become addicted to it. And it's a terrible disease to be addicted to. And, unfortunately, we don't always treat drug addiction as a disease. The system criminalizes it. We arrest people and we tell them, you violated the law and we want to put you in jail. When what I try to do with clients who've been arrested is to identify whether or not they have a drug problem. And if they have a drug problem, all right, what I usually do is I'll send them to an expert to be evaluated. Someone that I trust to be able to say to me, look, Rob, I've run the tests on your client. I've given him some, random testing, and I'm telling you, in my professional opinion, your client has a problem. Now, I'm not submitting that report to anyone. That's just for me and my client to know straight up that he or she has a problem. Now we've identified the problem. Now, what I like to try to do is I like to try to get my clients to focus on a long-term solution. You've been arrested for using drugs. You have a drug problem. You're a young person. Do you want to live this way for the next 20 or 30 years? Or do you want to try to help yourself fight this disease, get better, so that you can become a productive member of society, get a good job, have a family, get married, do the things in life that, most of us want to do? And so I'll try to encourage them to, seek treatment if they have a problem. And, courts are very understanding if you come forward, even on a case where your client's been selling drugs. If you can make the case to the prosecutor, which takes time and energy, but if you can make the case to the prosecutor that your client is a drug addict and not a seller out there looking to profit and make money, then oftentimes you can convince them that your client needs help. And the help that he needs is a drug treatment program to help with this addiction. And I've had tremendous results with clients who've been able to get into programs, and I use an expert to try to help me identify whether I need an outpatient program once a week, twice a week, whether I need an intensive outpatient program 3 times a week, 5 times a week, or whether I need an inpatient program. Because if I've got a client that's been abusing for years, well, going to a treatment program once or twice a week, that's not going to solve the problem. This is going to be an individual who's going to need long-term care, all right? And I want to try to work with him to try to get him to a better place. And I want to try to get him into a program that is going to address, his drug problem, but also the underlying mental health issues. Because typically, when you're dealing with clients who have substance abuse problems, it's usually because there's underlying mental health issues, psychological or psychiatric type problems that can date back in their life. And there could be a myriad number of issues. But the point is that you need a comprehensive program that's going to address those things. You can't just address one without the other. And that's why I have an expert in place to help me navigate this and find what's going to be the right program that's going to address the particular problems that my client has. Because every case is different. You could be charged with sale or possession of drugs, but every case is going to be different. And you need to take an individual approach to every one of those cases. And a lot of what I try to do when I talk to the prosecutors is I try to get them to understand my client and his background and the circumstances of his life that brought him to this place. And how do I make my client different from every other guy that's going through the system? And that's why it's important that when I'm working with a client, okay, that I get as much background information as I can about my client to present to the district attorney's office to try to see if we can work out a favorable resolution to his case.